today we will discuss with care guidelines. So care guidelines are the reporting guidelines. So there are there are various reporting guidelines for reporting different types of or for writing different type of research studies, depending upon the methodology and what is that type of disease. But this care guideline is used to report the this care guidelines are used to report the case reports. Okay, so they will provide you with a checklist. Like this is a checklist, as you can see it on your screen. So they'll provide you with a checklist, and that checklist consists of certain items or topics, and in that topic what you have to write, like in the under each topic, under each section, what you have to write, that is defined. So it will be a great help for the authors, for the writers, because they are getting to know that what they have to write in that particular article or in that particular research report, so that nothing important gets missed out. Okay, so first is, so like let's discuss this checklist, that what are the items of this checklist and what you have to write in that. So first is the title. First thing you have to write is title, and title is the diagnosis or intervention of primary focus, followed by the word case report. Okay, so the title you have to write, in which about what diagnosis or intervention the case report is, that you have to mention. And along with that you can mention the word case report. Okay, because so that when the readers, they go through the article, so the first thing what is read, that is the title of the study. Okay, and if in the title it is not mentioned that what actually this case is about, then it is difficult to understand, or then it becomes difficult to understand that what is the case, how it is, what is the article, what is the study, what is the design of the study. So it is, if it is clearly defined in the title, then it becomes easier for the readers to understand that that this is the report and this is the study which is about a topic or something, and so that they can go forward to read the article. So that's why it is very important to mention that what type of study it is. Suppose, for example, if it is a randomized controlled trial, so in that case you have to mention that it is a randomized controlled trial in the title. Okay, then next you have to write the keywords. So 2 to 5 keywords that identify diagnosis or interventions in this case report, including case report. Okay, so then you have to write 2 to 5 keywords. So 2 to 5 keywords can be related to the diagnosis or intervention of that disease or condition about which the case report is being written, and there should be a word case report which is also used as a keyword. So the keywords, which are the words which are repetitively used in that article, they can come and which comes again and again in the article, so they can be used as a, those keywords can be used as a those words can be used as a keywords. Then next you have to write the abstract. Okay, so now the abstract can be written in two ways. Okay, structured and unstructured. Not only in case report, in any type of article, the abstract can be written in two ways, that is structured and unstructured. So does anybody understands what does a unstructured and a structured abstract is? What is the difference between the two? So I hope you all understand what abstract is. In case if you do not know, then abstract is brief. In brief, you have to write everything what you have written in your case report or in any article. Like in general, I'll tell you what is abstract is. Abstract is a paragraph, okay, in which you have to brief out all the details of the article. What you have written in the article, what is the objective of the article or the study, and what is the methodology which is used, and how the results are obtained. So that is the abstract. Okay, then after, so that is the abstract. So now the abstract can be written in two ways, that is structured abstract and unstructured abstract. Okay, so structured abstract, like as Shruti said, that structured abstract is written when you are writing all the things, but they are separated into headings, into sections, like introduction, then you are describing brief. In brief, you're writing about the introduction, then you're writing the method, then in brief, you're writing about the method. So this is how it can be written in a structured manner. And unstructured abstract means when you are writing all the things, like you are writing the introduction, method, result, everything in the abstract, but in a paragraph form in one go. It is not separated by different paragraphs. It is written in a paragraph form. So like I'll just demonstrate you, then you can understand, and then when we will go through the various articles, so in that way from those examples you can understand that how the abstracts can be written. So the unstructured abstract can be written as abstract, and then in a paragraph form it is written. So this is known as unstructured abstract. Then structured abstract means the heading abstract, then after that you write the next subheading, that is introduction, and then you write 3-4 lines about it or a paragraph about it. Then after that you write method, the next heading method, and then you write about the method. Okay, and then result, and so on. So this is how you can write the unstructured abstract. Okay, so there are two ways you can write the abstract. So in case if it is mentioned in the guidelines which you are following, or it is mentioned in the introduction to author that what abstract you have to, what type of abstract you have to write, so you can follow that. But in case if it is not mentioned, it is not defined that you have to write unstructured abstract or structured abstract, so you can now it is your choice that which type of abstract you have to write. But generally when you are writing the case report, unstructured abstract is written. Generally when you are writing the research studies or the reviews, in that you will be writing the structured abstract. Okay, so how you have to write the abstract? First you have to write the introduction, that is what is unique about this case and what does it add to the scientific literature. So what is new thing, what is the new which is mentioned in that literature, what is the uniqueness is in the case report, and or what is a rare feature which is explained in this report. Then main symptoms and or important clinical findings. So what are the main symptoms of the patient about whom you are writing this case report, and what are the important clinical findings. Then main diagnosis, therapeutic interventions and outcomes. So what is the main diagnosis, what is the main diagnosis which is done, all the diagnostic tests, what are the results which are obtained from the diagnostic test. What is the therapeutic intervention? Therapeutic intervention means the medicines or the drugs which are administered to the patient, and what is the outcome of that treatment which is offered to the patient. Then after that you have to write the conclusion, that is what is the main takeaway lesson from this case, means what do you understand by this case, what is the main knowledge the readers will get when they read this case, or what is the new thing which is it adds, what is the new knowledge it adds to the medical field. Okay, so this you have to write in the abstract, and also you have to write, so the takeaway lesson only describes the objective of writing this article. So whenever you are writing any article, whatever type of article it is, whether it is a case report, whether it is a report, whether it is a research writing, whether it is a review writing, you have to mention the objective, why you are doing this study, why this study is written, what is the aim, what is the objective behind writing this article. It should be cleared. Then next, after writing the abstract, the next thing which you have to write is the introduction. So about introduction, you can write 1 or 2 paragraphs summarizing why this case is unique. Okay, so in 1 or 2 paragraphs, you can summarize that why this case is unique and what is new which is there in that case, what you learn from this, like what is known about this case or the disease or the diagnosis or intervention about which this case is. So you have to write in introduction, like in brief, that what is about that disease. Okay, 1 or 2 paragraphs, and then after that at the end paragraph you can explain about the objective and what is the unique feature of this case. And in introduction you can include the references, and in abstract no references are included. Then after that you have to do the case presentation, and in the case presentation first you have to write the patient information. So the patient information you have to write, that is the de-identified patient specific information. Like you cannot identify the patient, you cannot use the direct name or whereabouts of the patient by which the patients can be identified. You can write it as a 32-year-old a 32-year-old American woman working in a bank in New York. Okay, like this you can write. So this is a de-identified information. that no one can identify that who that woman is or who that patient is. So like this, you can write the information which is known as de-identify patient specific information. Okay. And you cannot directly or indirectly reveal the identity of the patient. It is unethical. Then primary concerns and symptoms of the patient. So what is the primary concerns of the patient? What are the symptoms present which he or she is complaining about? Then medical, family, and psychosocial history, including relevant genetic information. So you can write about the medical history, or what is the medical, what is the family history, what is the psychosocial history. Okay, so medical history means like if the in past, if the patient has had suffered from any disease or any disease which is major. Okay, family history, if the patient is having any family history of any disease, especially about the disease which they are complaining. Then psychosocial history, so if the patient has any episodes of depression, anxiety, maniac, if the patient is maniac, so any, generally these psychosocial history is required to be written in case of any patient when you are writing the case report about any psychological disorder. So in that case, the psychosocial history is important. But in case if the patient as such is having any problem related to which is a psychological disorder, that you have to write, including relevant genetic information. So relevant genetic information means when you are writing about any information which is related to any genetic origin of a disease or having any hereditary in the patient, which can transfer, which is related to the transfer of disease from one generation to another. Then next you have to write about in the patient information relevant past interventions with outcomes. Past interventions means like if the patient has undergone any treatment, a major treatment or a surgical treatment in past, and what is the outcome of that treatment, that you have to write. So major treatment, major disease only you have to include. You cannot include like the patient in past suffered from fever. This you cannot write. Any major past event which occurred with the patient, any surgery or any treatment, and what is the outcome of that treatment, that you have to write. Then next you have to write about the clinical findings. Item number 6 is clinical findings. In that you have to describe the significant physical examination and important clinical findings. So like you have to describe what is the physical examination of the patient. Okay, the physical examination means like what is the temperature, what is the heart, what is the pulse rate, what is the oxygen concentration, what is the blood pressure, what is the weight of the patient, any sign of any bleeding or any rashes, inflammation, which can be superficially visible on skin or any other on skin, any part of the body, any redness, any itching, any puffiness, if there is, which is examined physically, so that you have to write. Then timeline. So historical and current information from this episode of care organized as timeline. So what happened till like from any symptoms which the patient is complaining about. So since when the patient is suffering from that symptoms, if the patient has any emergency situation, like the patient has met with an accident or anything, so at what time the patient has met with an accident, and there is a time gap between the patient met with an accident and then after that he or she brought to the hospital, so that you have to write. Then next is that is known as a timeline. So each episode you have to of the diagnosis of the disease, of the treatment which is offered, that is known as a timeline. With time you have to write. The next is you have to write about the diagnostic assessment. Okay, so in this you have to write the diagnostic testing such as physical examination, laboratory testing, imaging, and surveys. So you have to write about the physical examination, whatever physical examination is done, what are the laboratory testing which are done, any scanning is done. Then diagnostic challenges such as SS2 testing, financial or cultural, in case if the patient is facing any diagnostic challenges, and which can be SS2 testing means sometimes the testing laboratories are not available, and generally it happens in the rural areas where the laboratories, pathologies are not available, and they have to travel to a city, to a nearby city, to get their samples tested. In case, and or what happens in that, if their samples get collected, and then after 3 days, 4 days, or in a week, they will get the they'll be getting that report. So then till then the treatment is delayed. So that's why it is a challenge. Financial, some diagnostic tests are very expensive, and generally the people who are living below, who are low income, they cannot afford those testing. So these are certain challenges which the patient can experience while getting themselves diagnosed for any disease. So this comes under the diagnostic challenges that you can mention. Then diagnosis. So what are the diagnostic tests? Whatever the diagnostic tests were conducted on the patient, so what is the result which is obtained from those diagnostic tests? Then you can write about the prognosis, such as staging in oncology where applicable. So prognosis means to prospect or to manifest that in future the patient can suffer from any disease. Suppose, for example, if like now at a current stage you do not have any problem, okay, and suppose you go through a blood test, a regular blood test, and in that it is said, and that it is seen in that test, it is seen that the blood glucose level, or sorry, the blood cholesterol level is slightly higher. Okay, so and from that report is seen, or it is detected that the blood cholesterol level is slightly higher. So from that is higher, and then from that it can be prognosed that maybe the person in future can suffer from any cardiovascular disease if this condition left untreated or unchecked. Okay, so the prognosis is generally reported in case of oncology, means any abnormal growth of cell if it is seen in any part of the body. So that can be the condition that the patient in future can suffer from tumor or cancer. So that needs to be reported. Then next you have to write about the therapeutic intervention. So type of therapeutic intervention, such as pharmacologic, surgical, preventive, or self-care. So what type of therapeutic intervention? So therapeutic intervention, the drug, the medicines which are given to the patient, and the treatment can be pharmacologic, means the drugs which are administered, prescribed to the patient, and surgical if the patient has undergone any surgery. Preventive and self-care means when the doctor counsels the patient along with the medicine, or if they have undergone a surgery, that what preventive measures, what self-care they can give to themselves, or ask their family members, so how they can take care of the patient. Then next is administration of therapeutic intervention. So the patient is undergoing the treatment and they are receiving the drugs. So what are the drugs they are receiving, what are the doses which are prescribed, what is the dose strength, and till what duration they have to be on medicines. Then changes in therapeutic intervention with rationale. If the patient is not responding to the treatment, if the treatment is not efficient, if due to the treatment or any of the drug which is administered to the patient, they are having any adverse events has been reported, so then in that case the treatment will be changed. So what is the reason for changing that treatment? Okay, so that you have to write. Then next is important. Then next you have to write about the follow-up and outcomes. Clinicians and patient assessed outcomes if available. So then you have to write the details about the clinician and patient assisted outcomes. So now whatever the treatment which is provided to the patient, whether it is a pharmacological treatment, whether it is a surgical treatment, so what is the outcome which is seen? Okay, so clinician and patient assessed outcome means like when the patient can himself or herself assess the outcomes, like the patient can see that what the patient can like suppose if I'm suffering from fever and after taking the treatment for 3-4 days, now I'm feeling better, there were no symptoms of fever, my body temperature is also down. So in that case, so that can be assessed as the, so that means that I have been recovered from fever. So this is the outcome which I have assisted. So this is known as the patient assisted outcomes. Now when you are undergoing a treatment and the patient has to monitor you, the clinician, they are monitoring you, the doctor is monitoring you, and from that it can be assessed that the patient is recovering from a disease, the blood pressure is lowering, or any sign by which it can be seen that the patient is recovering from the disease, or whatever they are suffering from, disease, or they are undergoing a treatment process. So that means that, or the disease is being under management, it is under control. So that is known as clinician assisted outcomes. Okay. The next is important follow-up diagnostic and other test results. In case if to detect that whether the treatment which is prescribed to the patient, whether that treatment is working or not, whether the patient is recovering from that disease or not, and for to confirm that, if they have to undergo any diagnostic test, and what is the result which is obtained from that test, or any other test which is performed. So that is known as follow-up diagnostics test, as it happened at the time of COVID. Suppose if any person suffering from COVID, then after 7 days he is again subjected to the RT-PCR test, and RT-PCR test, and then after that it is tested that suppose if they undergo the RT-PCR test again, then in that case they have to find out that whether then after 7 days it is again, they are again tested. If the result again comes positive, that means the infection is still there, and they are again subjected to the treatment. And then after that, then again after coming 7 days, they will be getting tested. So they were tested, so to confirm that, after that it is the result came that the report is negative, that means they have recovered from the disease. So this is what the follow-up diagnostic tests are performed. Then intervention adherence and tolerability. So you have to write about the intervention adherence, like how well the patient has adhered to the treatment and which is offered to them, and how well, suppose in case if the patient didn't complain about any discomfort or any type of adverse event doesn't occur, and even there were no discomfort while he or she was taking the medications, so that means the patient has well tolerated the drug, well tolerated the drugs, the treatment which is offered to him or her. And if intervention adherence means, like if 10 tablets are given to him, and all 10 tablets are finished, like if in case 2 tablets are left, so that means that indicates non-adherence to the treatment, because the patient has skipped 2 doses. Okay, so like this you can assess the intervention adherence and tolerability. The next is adverse and unanticipated events. So while the patient is undergoing the treatment, if they suffer from any adverse or unanticipated event which was not known, that these events can also occur in relevant to the drugs which are administered to the patient, so that can be written. Then after that you have to write about the discussion. So in discussion you have to write a scientific discussion of strength and limitations associated with the case report. So what is the strength and limitation of the case report that you have to write? Then discuss the relevant medical literature with references. So what are the medical literature which is already available in connection with this type of case report, with this type of disease or diagnosis or intervention? So that also you can mention with the references. Then you have to write about the scientific rationale for any conclusion. So if there is any background, which a scientific background or a hypothesis by which you can properly explain the conclusion, so that you can write. Then the primary takeaway lesson for the case report. So what is the primary takeaway lesson which the case report is about? In one paragraph of the conclusion you can write about that. Then after that you have to write the patient perspective. So the patient should share their perspective in 1 or 2 paragraphs on the treatment they receive. Okay, so you have to write the patient They should share their perspective in 1 or 2 paragraphs on whatever treatment they have received, what are their own opinion, what they have, how they are feeling, what they have faced, what are the challenges they have faced. So in case if the patient is ready to share their perspective, then you can write it. You can interview them and then you can write it in the document. Then informed consent. So did the patient give informed consent? Please provide if requested. So in case if the patient, now whenever any study is conducted, whether when you are writing a case report or it can be any qualitative study or a quantitative study. So any type of study it is which is conducted on human beings, where you are using the data of the humans and any testing is done on humans. So for that you have to take the informed consent form. So here also, when we are writing the case report, we are using the medical data of any patient. So for that we have to take the consent from the patient, that whether they are giving the access or whether they are agreeing to it or not. And also if they have provided the consent, then too we cannot reveal the identity of the patient. Okay. And then when you are submitting this manuscript to the general, you have to submit the informed consent form along with this manuscript as well. Okay, understood everyone? So these are the items which you have to include when you are writing a case report. Okay, understood everyone? If